Alright, so we are going to be looking at our MARS to see what medications we need to be giving right now. So it looks like Millie Larson, birthday of 1/1/36, has 2 medications that are due right now. She has furosemide, 20 milligrams IV push that is due for edema and blood pressure to be given over 2 minutes. She also has insulin due 10 units, subcutaneous, supposed to be given with breakfast for her blood sugar. Her medical record number is 123456. So this is the right patient. These are the right medications. I'm showing no drug allergies to any of these medications on her MARS. We already talked about the routes, and the time to be given is now. We're going to start documenting her medications. We're going to draw up the medications and get them ready to be given. So again, while we're confirming everything, I'm going to be getting ready the furosemide. I have a 23 gauge 1-inch needle. I'm going to be using a 3 milliliter syringe. So the medication, the furosemide, is right here. So this is a 100 milligram container. So there's 10 milligrams per milliliter. So 2 milliliters would be 20 milligrams. So I'm going to get a 3 milliliter syringe to draw these up. Going to attach my needle. Okay. Before we do this, perform hand hygiene. I do have hand sanitizer here. Oh, sorry. So again, 2 milliliters is 20 milligrams of this medication, furosemide. We are using the 23 gauge 1-inch needle. Okay, we're going to extract that down to 2. Clean off the top of our medication. Insert our needle into the mid. Going to 2. Okay, we're at 2. We want to make sure there's no air bubbles, there's no spaces or anything like that. Okay, got rid of all those air bubbles. We're still at 2. You're going to dispose of this needle. It is capped and it is gone into our biohazard. Now we are going to place a covering on this, and we are going to label it with a piece of tape. Furosemide, 20 milligrams, Millie Larson. Okay, got my tape here. I'm going to label our syringe so we know what medication it is. Right, we're going to draw up our insulin now. I do have a regular insulin needle to use. This is a 1 milliliter needle, insulin needle, or 100 units, 29 gauge by 1/2 inch. Regular insulin needle. This is measured in units. We are giving 10 units. I do have the insulin right here. Total of 100 units in here. We're going to clean that off. Uncap our needle. Push in. Draw up to just 10. We are at 10. Making sure there's no air or air bubbles. Okay, it looks pretty good. We're at 10. Going to cap this until we're ready to use it. Our medicine under there. And we're going to label this one as well. Okay. Do have my label ready here. And we're going to put this on here so we know. Got it all ready. Okay. Gonna double check our MARS, make sure we have everything correctly. Double check the route of the medication given. We have IV push for the furosemide and subcutaneous for the insulin. Making sure Millie Larson, birthday 1/1/36, no known drug allergies. We do have our right meds. We have everything drawn up and ready to go. Right route ready to go, and currently supposed to be giving this now. These medications are due now. We're going to go in the room, explain to Melly what we're going to be doing, that it is time for her medications. We're going to verify with her wristband here that this is the right time for her medications, her name, her date of birth, no known drug allergies. So this is the right patient. She's also confirming that her name is Melly Larson. Her birthday is 1/1/36. We're going to, again, perform hand washing. And now we are going to first give the subcutaneous medication. We're going to don our gloves for this procedure. We want to make sure we have a very thicker subcutaneous area, most notably the upper arm, but currently today I'm going to be using the abdomen. We're going to make sure that we are 2 inches away from the umbilicus, and what you need to do is make sure we have our gloves ready to go. Alright, we are going to get our medication ready. So this is the insulin, 10 units. We do have that cap jet. It is subcutaneous. We're going to find our area with your non-dominant hand, pinch to pull up on the skin, clean the area with an alcohol prep pad for approximately 10 to 15 seconds. So we have 10 units of insulin we're going to be giving subcutaneously to Miss Melly. This medication due now. Okay, now we're going to let that dry for another 10 to 15 seconds. So I am left-handed, so I am using my non-dominant hand to pinch the skin. It's important. After letting this dry, we're going to uncap our needle. Again, pinching that skin with your non-dominant hand. We have our label, we can confirm everything. Pinching the skin, we are going to go in with our hands kind of like this, at a 90-degree angle, straight in. Okay, Millie, you're going to feel a pinch. Okay, great job. And we're going to push that medication in. Very wonderful. Okay, we did it at a 90-degree angle like a dart. Didn't remove our medication. We're going to be disposing of our needle in our first container. Okay, disposed of that. I'm going to use a 2x2, pat the area if needed. Looking pretty good. I don't see any need to dress it or anything like that. Okay. Alright. One medication, we're going to document that medication was given and the time that it was given. Okay. We made sure that we didn't need to do anything else, like take blood work, get a BSG before giving the medication. Nothing like that was due before giving these medications. We did confirm that with our MARS and everything. So now we are going to be giving the furosemide, and this is an IV medication. So I'm going to have Melly move her arm up here so we can better see this. So for this medication, she already has the IV lock in place. So what we are first going to do, take a different alcohol prep. Okay. Clean the site here for 10 to 15 seconds, or 5 to 10. Alright, we're going to take a normal saline flush. and we're gonna pull back to aspirate some blood to make sure our IV is in place correctly. Okay, we're gonna pull back. We do have blood return. Okay, unclench our thing first. Make sure we have blood return. Okay, perfect. And now we're supposed to be giving 3 milliliters of normal saline before and after the procedure. So we're first going to slowly push in the 3 milliliters. You're doing great, Melly. Okay, it's pushing very nice and easy. We had that blood return. IV seems to be good. So now we push the 3 milliliters before. We're going to take a furosemide, confirm everything, no known drug allergies, right patient. This is the right dose, 20 milligrams, or 2 milliliters. And we're going to push this over 2 minutes. Oh, we need to clean this first. Before pushing the med, you need to clean this for another 5 to 10 seconds. Okay, and you're gonna want to hold this so it stays clean. I did forget that. Okay, now for 2 minutes. You're doing great, Melly. I'm gonna push a little at a time. 10 increments. So we can total out the 2 minutes. This time I just talked to Melly, asked her how she's feeling, if she needs anything, making sure she's comfortable. If she needs repositioned, if she needs anything to drink. One more minute. So again, in 10 increments, just letting it go for a minute. 10 increments, letting it go for a minute. Not an actual minute. She's having no bad reactions to the medication as I'm pushing them. Almost done. Alright, given all the medication to remove this while still holding our lock. I'm going to clean this again for 10 to 15, or I'm sorry, 5 to 10 seconds. Okay, those were the only 2 medications ordered for right now. And again, we're going to an additional 3 milliliters after. And this is just nice and slow. Alright, we're going to make sure Melly is in a nice comfortable position. Making sure she doesn't need anything else at this time. Okay, we got that clean. Going to remove my gloves and clean my hands, document everything in my MARS and initial everything, and that is all. Thank you.